So now that you've actually gone through the sling procedure, let's talk about a very important concept, what to do now that the sling is in. That's also very important. So let's go over this. So we will actually schedule our office visits. So you'll typically be seen 1 week after the procedure or a few days. If I did it on a Wednesday or Thursday, it'll be like next Monday, then 3 months, 6 months, and then yearly thereafter. During the visit, it'll be just a quick vaginal examination to make sure incision is healing well, the sling is in proper place, there is no pain at the sling site. Then we'll make sure their bladder is emptying well, and then we'll make sure how your muscles are. So I'll palpate the muscles and have you squeeze your pelvic muscles, and we'll grade it out of 6, or actually out of 5. So we'll know exactly what that grading is, and then we'll look at the grading over time. If on exam your pelvic muscle squeeze is good, let's say it's 4 out of 5 or 5 out of 5, then I'll just encourage you to do this on your own. So you should at least do like 8 squeezes. You hold each one for about 8 seconds. You count 1, 2, 3, 4, 5, 6, 7, 8, and release. I just did it. So do about 8 holds and do this 3 to 4 times a day. All in all, you're just asking for a few minutes in an entire 24-hour time period. And you should do this for the rest of your life. The best thing to do is associate this with a daily event. For example, traffic lights. Come to a red light, put the car in park, and do your pelvic floor exercises. TV ads, same thing. And what I tell my patients, earn your toilet paper. What does that mean? This is also important because after you urinate, you want to make sure that you tighten the pelvic muscles. So before you take the toilet paper, tighten the muscles, do your little score count a few times. Doesn't have to be 8 times. Do a 3 or 4 times each of 8 count hold. Then use the toilet paper. Why this is important is because some women also complain of post-void dribbling. That means after they've urinated, they'll stand up and they'll dribble a little bit of urine. By doing this immediately after completion of urination, you will help take care of that. If your muscles squeeze is poor, then I'll have you see our physical therapist who will do the pelvic floor therapy once or twice a week at the office and monthly boosters thereafter. So it has a special machine that helps strengthen the pelvic muscles, and it's not required in everybody, but in especially those who have a weak pelvic muscles. So the sling is there. This is a sling. It's anchored nicely to those muscles. All you got to make sure that these tree trunks don't sag in, because if the tree trunks sag in, the hammock loosens and it is ineffective. So keep your muscles strong. This guy is not going anywhere. So remember, when you had the stress incontinence, that urethra was fallen down, all these ligaments had broken. So what did we do? We put the urethra, the sling back, but now you have to get the water level up. You've got to tighten the muscles. So the sling, along with strong muscle, will keep this boat afloat and in place. That's exactly what you want. So we'll set up this at your convenience, your office visit. It will not last more than 5 minutes, and all your post-operative visits are free. It's very important because it'll help me understand how strong or weak your muscles are. And if they're tending to get weaker and the score is dropping, the pelvic floor score, then I will know immediately and we can start some pelvic floor exercises before any problem happens. So this way we can completely avoid recurrence of urinary leakage. So follow-up is crucial, and the other part of the follow-up is to answer those questions. How long will my sling last? So if all our patients come back, this is the second benefit. I can answer these questions. Will it need to be tweaked? What after I became a menopausal? So bottom line, my technique, the disc technique, has almost 100% success with almost 0% complication rate, but you need the pelvic muscles to keep the sling where it is. Don't take your bladder for granted. Make sure you void and empty your bladder every 2 to 3 hours also, and follow up with us as per our protocol. Contact us if there's any question, any issue with the bladder. You must call us before calling anybody else. The next thing we can talk about is you may have had only stress incontinence, but in case you had mixed incontinence, that means you had some element of overactivity of the bladder or urgency leakage, then that can be also managed differently. And next, we shall talk about management of overactive bladder and what is overactive bladder. Take care.